Okay, let's make a start back. So we're moving on to thinking about the statement of purpose and what needs to be included within your statement of purpose. So it's an important document. It sits under the Leadership and Management Standards and within Regulation 16 of the regulations, and it sets out the aims, objectives and ethos of the service, including what the service offers and how it can meet the needs of young people who may be accommodated in the service. It sets out how it's set up and equipped to meet those needs. The information that's set out in the Statement of Purpose is an essential part of the process of agreement between the registered person and the accommodating authority, ensuring that a placement with a provider is the right one for that young person and that the service is going to be effective in responding to and meeting young people's needs. Accommodation authorities are going to use the information that is contained within the Statement of Purpose for their decision making around which service and provider can best meet the needs of young people. So the Statement of Purpose must be submitted as part of stage 1 of that process, and the statement should be made available on request to staff, young people and their parents if necessary, and accommodating authorities. The full information for inclusion in the Statement of Purpose is set out in Regulation 9, and it's also information is included within your learner handbook as well. Some of the required information that I won't cover today are the basics information. So what I thought would be more useful for this session is to look a little bit more into the areas into which more thought and consideration and discussion should be given. The statement needs to set out the categories of accommodation that's going to be offered by the service, and if the service delivers more than one category, then each of those should be addressed within your Statement of Purpose. Providers must tell Ofsted which category or categories you're applying to operate under for your supported accommodation. At the point of registration, registered persons must demonstrate that they have the capacity, the appropriate experience and the skills to manage or carry on the service, having regard to the category or categories of supported accommodation which will be provided. So in terms of the accommodation, you need to provide a description of the accommodation. This needs to include what's currently in place, but also how you might be able to adapt it to meet the needs of individual children accommodated. And it also needs to set out your security arrangements that are in place as well. In terms of your services and facilities, you need to include a description of what the service offers and how it can meet the needs of prospective young people who may be accommodated in the service, and how it's set up and how it is equipped to meet those needs. You need to include current information about the characteristics of young people that the service intends to provide accommodation and support to, according to their needs and or level of autonomy, who would be suitable for and thrive within your setting. This will include the age range that the accommodation intends to take, the number of young people who can be accommodated, and whether it is a mixed or a single sex provision. And then thinking about your support, what level of support is offered by your service? This is going to include details such as the arrangements in place to support young people with special educational needs and disabilities, those with health needs, and this will include mental health needs as well. And this information will support accommodation authorities in matching young people to the right accommodation to meet their needs. And this will link in with the support standard. Thinking about your staffing. Staffing levels need to be set out, and these need to meet the needs of young people and have flexibility to respond to unexpected events or opportunities. And staffing structures should be promoting continuity of support from the young person's perspective. If the needs of young people mean that staff are not required to be on site 24 hours a day, you must make sure that you have arrangements in place to ensure the safety and ongoing support of young people, and this will include access to 24/7 on-call support. The degree of staff involvement should be set out so that young people and local authorities are really clear on what they can expect, and this is going to depend obviously on the needs of young people accommodated within your setting. The statement needs to address how staff are going to work effectively as a team to meet young people's needs, and should therefore have the right level of experience and skills in order to be able to do so. You're going to be keeping your statement of purpose under review once registered to ensure that the focus remains on the young people and that the service provides individualised support to meet the quality standards and to improve outcomes for young people. Any reviews you undertake need to take into consideration any feedback that you've received from young people or other stakeholders. That will include your staff, accommodation authorities, etc. Also, any complaints that have been raised by young people or staff or any other stakeholders, to make sure that any changes that you make to your statement of purpose are having a positive impact on young people. The registered person must ensure that the service and setting is conducted in line with your statement of purpose. Any updates to your statement of purpose need to be made as and when necessary. So there is not a review cycle for this. You want to keep it under constant review, but you might want to set yourself sort of an annual look at this, but obviously make any changes in between if necessary. And if you're going to make any changes to your statement of purpose, you need to make sure you do two things. The first is informing young people of the changes and reason for them, and any current accommodating authorities that you are currently engaging with. And also you need to inform Ofsted as well of any revisions, and you need to provide them with a copy of that updated statement of purpose within 28 days of those revisions being made. So when you're developing your statement of purpose, some of the key things that you want to be considering: you need to be considering what categories of supported accommodation your service delivers. How does the registered person and the service demonstrate that they have the capacity and appropriate experience and skills to manage the service that you're setting out? If you're going to be delivering under more than one category, how are each of these going to be addressed? How are you going to describe the accommodation, and how could you adapt that accommodation to meet individual needs of young people where necessary? Considering what security arrangements you have in place and setting that out within there. Considering your characteristics of young people that the service is going to be providing accommodation and support to. So this will include the ages, the numbers of young people, and considering whether this is a mixed or a single sex provision. Thinking about the support that's offered, what level of support is in place? What level of support will the service offer? Then considering what arrangements you have in place for those young people that may be accommodated who have special educational needs or disabilities, or health, including mental health needs. Considering your staffing levels and how can staff levels respond to unexpected events and opportunities. And then considering for those of you that don't have staff on site 24 hours a day, what are those arrangements in place for on-call support 24/7? So young people have somewhere to contact if they need to. So you're going to be looking also at a degree of staff involvement is in place, and how your staff are going to work if there's more than one member of staff, how they're going to work effectively as a team to meet young people's needs. How are you going to ensure that they have the right experience and skills to be able to support young people and to meet their needs? And considering what mechanisms you have in place for reviewing your statement of purpose. And when you do review, ensuring that you are taking into account any feedback and complaints that you have received. How are you going to ensure that young people's rights and views are at the centre of the support and service delivery in your planning? And how, really importantly, you're making sure young people are fully aware of their entitlements. This will include the provision and their entitlements as looked after children or care leavers, and entitlements to education, training and employment. Thinking about what are the positive outcomes you seek to achieve for young people, and what is your services approach to achieving them, and how you're going to support the development of independent living skills for young people. So the case records, obviously we've touched at points on case records already, so this is kind of bringing this all together, considering your case records. So Regulation 24 sets out the case records that supported accommodation providers must keep, and Schedule 2 lists the records that must be kept. So it's really easy for you to see that full list. These all sit under the protection standard. Important to understand that records on each young person represent a significant contribution to their life history, and they should really therefore represent an accurate account of that period of that young person's life. Guidance is really clear that staff should understand their important role in encouraging the young person to reflect on and understand their history according to their needs. So in terms of our guidance, obviously we have the supported accommodation regulations. Earlier I mentioned that information sharing guidance, and I mentioned that that's in consultation at the moment, so it will be updated, so do keep an eye out for that. And obviously thinking about your local safeguarding partner policies and procedures and making sure that you're linking them with those, you know, the procedures that are specified by your local safeguarding children partnership for the area in which that supported accommodation setting is located. So what are the requirements? You need to ensure that you have policies in place for record keeping and information sharing. It's important that all records are kept up to date. It is really, really important that you are on top of your record keeping, that records are made at the time. Human memories fail, so if records aren't kept at the time, people will be trying to remember important information and might not get those details correctly. So staff need to understand through their training and induction the importance of keeping those accurate records at the time that they happen. So those opportunities to see a life history, but also our opportunities for reflection on actions taken, really important. Some of you will be using electronic records and some will be using written paper records. If you're using paper records, making sure that staff are signing and dating each entry. So it needs to be really clear who has recorded each part of those records, whether that's electronic or on paper, who's recorded it and the time and date of that as well. Obviously, any written records using pen only, so we don't want anything in pencil. That can be changed at a later date. If any mistakes are made in recording and it's a written record, then it needs to be just one line through, and so that we can still read what was written previously, but we can see that that has been updated with well, I say updated as in it was incorrect information, maybe written incorrectly. Just put a line through it so we can still read what that is. Guidance is really clear, and it emphasises that case records must not stigmatise young people, and that they should be objective, and they need to be helpful. And within our records, we need to determine what is a fact, be really clear about anything that is an opinion, and we need to be really clear about information that is third-party information as well. So clearly stating where that information has come from. We need to be considering all of our records, thinking about our information that we're keeping about young people and recording them in a way that's going to be really helpful to that young person, as well as obviously helpful to us in our professional roles in terms of looking at what's happened over a period of time. We have clear responsibilities towards young people and also towards their parents and anyone else who may have parental responsibility, and we need to support young people and parents and those with parental responsibility to understand the type of records that are going to be kept by the registered person and also how they can access them. Young people should be actively encouraged to read their records, and they should be supported to do so. They should be supported to add further information to their records. Some young people may not want to see their records now at the time, and that's okay. That's their right not to look, but they need to know they have the right to look if they want to. And they need to understand that they have a right to access them at any point in their lives moving forward. So even if they don't want to look at them now, that's fine, but they have that right to moving forward at any point in their lives. So they need to be informed about their rights and the records that they're kept, the records that are kept about them. And they should be provided with information as to how they can access those records in later life as well. So in terms of your staff training and your staff awareness, using induction and regular training to ensure that staff are familiar with your settings, policies and procedures for record keeping and the records that are being kept, and the why, really understanding the why behind those accurate records, and maybe understanding what can go wrong if accurate records aren't kept, supporting them in their understanding. You should be applying some level of quality assurance to your records, so someone should be checking over them to check that we are containing all the information that we want, that we've written them in a way that isn't stigmatizing, that is helpful, and making any necessary changes to your procedures, to your staff training, if needed, if we're feeling that the records being kept aren't actually up to the standards that we'd expect them to be. Staff needs to be really important, really need to understand the importance of careful, objective and clear records, and they need to be familiar with information sharing requirements as well. So as I've mentioned a few times today, we have that government information sharing guidance. Please do make sure that you've had a good look at that, that you understand it, your staff understand it, and that obviously when that 2023 version comes out, that you make sure you update anything that you need to in line with that new guidance. From what I've seen in terms of the consultation, the document out for consultation, it's about strengthening and actually clarity around information sharing rather than any significant changes to your practice. It's about clarifying those areas. So in terms of the 7 golden rules, these are set out within the information sharing guidance. One of you mentioned GDPR earlier. We have General Data Protection Regulations and the Data Protection Act 2018, and we also have human rights laws as well. And these things are really important. So we need to consider when we're holding and sharing people's information that we do it in the right way, that we are respectful of people's personal information. And, you know, the law says that we have to do so. But also, it says that this is a framework and that where we have concerns around children's well-being and welfare, then we can justify information sharing. So as it says there, these are not barriers to justified information sharing, but they provide a framework to ensure that personal information about living individuals is shared appropriately. So it's not that we don't share it, it's that when we do share it, it's appropriate. It's also about being open and honest. So that honesty with our young people and their families and other stakeholders about what records we hold and why is really important. And if we're going to share someone's information, in most situations, we are going to share with their consent. So consent sometimes is just informing them. It's not in every situation them agreeing to us sharing it, because sometimes we have to override someone's where they haven't given consent because actually it's in their best interest for the welfare and safety. We may have to share that information. In most situations, you're going to inform them that you are doing so. There can be very rare occasions when you wouldn't tell someone you're going to share their information. So we're going to be open and honest. And if we're not sure about sharing information, we're going to seek advice and guidance from others to make sure we're doing the right thing. As it says, there's share of consent where appropriate, but you may still share information without consent if, in your judgment, there's a good reason to do so. And so in your judgment, you need to be keeping clear records of your decision making around sharing information without consent. If you've chosen not to gain consent or you've spoken to them and they've not agreed, you need to keep in your records the reasons why you are overriding that, what their viewpoint is, what your viewpoint is. You're always going to consider safety and well-being above and beyond anything else. Where you do choose to share information, we're only going to share information as necessary, where it is proportionate, so considering how much information you're sharing, is it relevant, but is it adequate? So if we don't want to overshare too much information that's not important to share equally. You don't want to undershare and not provide adequate enough information for others to either build a bigger picture or make the right decisions themselves. It needs to be accurate, so those good accurate records are really important. Where we share information, we need to share it in a timely way, and it needs to be shared securely. So thinking about your secure methods of sharing information, for example, if you're sharing by email, how are you doing that securely, particularly if it's documents, considering how you're going to password protect, etc., and have that set out within your policies. So your staff are really clear about how information can be shared securely. And any record keeping, you're going to keep a clear record of your decision for it, your reasons for it. So anyone asks in the future, you can refer back to that information that you have there. So in terms of the case records that you're going to be held, Schedule 2, as I said, sets out the full details of the records that must be held. And these will include personal details, so things such as name and date of birth, sex, religion, ethnicity, address, etc. Contact details of certain persons relating to the child, such as parents, professionals involved, such as policing authorities, social workers, school, college, employers or others. Any information relating to the care and protection and safety of the child. So these have been covered by the policies that we've already spoken about today, such as missing incidents, restraint incidents, health harming incidents, any restrictions on contact between the child and others, that could be parents or other persons. Any plans or reports relating to the child, so this could be education, healthcare plans, school or college reports, or any other relevant plan that's in place for the child. These will include things like their placement plan, care plan or pathway plan, or any other plan prepared by that young person's accommodating authority in relation to the remand or sentencing of a child. We're also going to hold health information such as GP details, records of accidents, illnesses, immunisations, allergies, health and medical examinations, developmental tests, dental or medical needs, any medication information that we're holding, including those that are being self-administered. In terms of our storage and retention, it's important that all case records are held securely and that records contain confidential information that should only be seen by those who have a reason to do so. So it's really clear in the guidance, records must be kept for 75 years from the child's date of birth, unless the circumstance in which the child dies before they are 18, in which case they're going to be kept for 15 years from the date of that child's death. And we must have procedures in place for retention of the records on the occasion that the setting closes or is taken over by a different registered provider. If they close, then the records must be passed to the Accommodation Authority. If the setting closes but the service continues to run other supported accommodation settings, then the records must be transferred to the nearest setting. And as I said, it's all set out within the guidance document. And the retention of the records for those required time periods are really imperative to ensure young people can access them in later life. So in terms of your key questions, you're going to be thinking about what the types of records you're keeping, where you're going to keep them, how you're going to keep them, how you're going to keep them so securely, making sure you're really clear around your record retention. The guidance is clear on that, so that needs to be clear within your policies. Thinking about what you do with records should your setting close or be taken over by another provider. How are you going to work with staff around their knowledge and skills and make sure that they are producing those accurate records? How are you going to quality assure your records? And how are you going to support young people to understand the records kept, and also how they can access them now or in the future? Making sure obviously you're compliant with your local information sharing policies and procedures specified by your safeguarding partners, and then making sure that you have clarity around the protocol for information sharing of serious incidents with Ofsted as well, to make sure that that Ofsted is informed. So let's have a look. I'm just going to have a look into the chat. Okay. Case records made on a management information system where name of staff making a record entry is forcibly identified or equivalent to signing, I presume. Yes. If your system makes sure, it shows who's put that on there. Just making sure staff are including details of anyone else that might have been present. So staff A reports an incident, for example, and staff B is also there. Staff A might be reporting on a system, but they should mention in their records that staff B was also present, naming that person and their role as well. Please try to avoid initials for staff members, because what it means is in the future, if we look back, we might not be able to identify that person. It's much easier to redact full names as well, actually, than initials. People can get a bit worried about putting people's full names in. These are confidential, securely held records. And if access requests are made in the future and some information needs to be redacted, that can be done so at that point. But remember, you're mainly being open and honest with young people about who's saying what about them anyway, so you shouldn't have to be holding that information from them. Then you're going to move those records to the nearest other accommodation, so that nearest setting to the one that's closed, or if they're taken over by another provider, who's going to be responsible for storing those records, making sure that they are transferred over securely, and considering if that setting closes or the service closes completely, then thinking about how you're going to speak to your local authority in terms of them taking over those records for you. And it's really important that records are kept for that required time period, because as I said earlier, we encourage young people to look at their records now, but of course whether they look at them now or in the future, they have every right to go back to them at any point. So we need to know that they're held securely and they can be accessed when they need it to be. So some of the things that you're going to want to be asking yourself as you're developing your case records policies is going to be around, what type of records are you keeping? How and where you're going to keep them, including your secure storage. How are you going to ensure that only those that have reason to do so are going to access those records? Where are your record retention information kept? So where can we see how long you'll be keeping those records for? What's going to happen to those records should the setting close or be taken over by another provider? How are you going to support young people to understand the records that you keep and to understand their rights to read them, but also to add to them as well at any points, and how are you going to make sure that you're compliant with information sharing. Thinking about some quality assurance as well, where you have a quality assurance and process in place for your records. You may want to bring that in order to have someone looking over those records, someone obviously within your service, just checking that the records are kept are correct and in order. And then thinking about protocols for informing Ofsted of serious incidents as well. Okay, so I'm just going to have a look into the chat. Don't LAs already have an obligation to keep records for 99 years, so we can just send the records to them and know they'll be kept? You'll need to speak to your local authority and just ensure, obviously, if you're transferring them, that they are taking those records, just making sure, again, if that's your process, is to transfer into your local authority, then making sure that's clear in your policies and procedures, so we know, and a clear record if they're sent anywhere, where they've gone to, so that that trail can be followed if necessary.
Okay, that's great. Yeah, I wanted to just to flag it really with you, because you know, it'll take a bit of time for you to process some of this information if you haven't seen it yet. So I'm not expecting you to have an immediate, fully formed response. But we have set out our proposals for inspections that start next April, and they're online. And we've got the link at the end of these set of slides, so we can share them with you if you haven't seen it already. But I just wanted to run through them. I'll just explain who I am, if that's okay, if people haven't come across me before. I'm, as the slide says, I'm from Ofsted, Matthew, based in the policy team at Ofsted, specialist advisor, looked after children, but mainly most of my life spent doing managing the project for supported accommodation and leading on the arrangements for registration and inspection. So I'll run through this very quickly because I know time is short. So this is what we've already agreed, that to inspect at the provider level. I'm sure you all realise that by now. And we're going to inspect each provider at least once every 3 years, more often for weaker providers usually, or for any other reasons if we have concerns. And we expect to do the supported accommodations under part of the social care common inspection framework, and if you already run other regulated provision, you'd be familiar with that. But the main thing I wanted to run past you was the proposal around the outcomes for the inspections next year. Most of you will probably know about the 4-point scale that we have for most of our social care inspections: outstanding, good, requires improvement, and inadequate. For supported accommodation, and at least for the first round of inspections, we're proposing something quite different, which is about these 3 outcomes that are on the screen at the moment, which we think provide a little bit more necessary nuance and a little bit more necessary detail for a sector that is really complicated. So there's 3 outcomes. One is about when service delivery is consistently strong, as the slide says, leads to typically positive experiences and progress for children. So that's that's a positive outcome. One is less positive, but not quite as serious as the third one, is when we see that quality of service delivery is more inconsistent, which adversely affects some children's experiences and limits their progress. We might play around with the wording. We have had some feedback that this is a little bit too harsh, and we need to think about that. But you'll have a chance to look at the wording and make your own mind up and let us know what you think. But you'll see there that we'd expect to go back within a shorter time scale of at least within 18 months. And then the bottom outcome we're talking about is serious or widespread weaknesses leading to significant concerns for children. And that next inspection will be within 6 months, although of course we've got other powers that if we were really worried and we thought we needed to take more serious enforcement action, we can do that too. So there's these 3 outcomes instead of that usual 4-point scale. We were really mindful of how varied supported accommodation is, and what we're worried about is that outcomes that we didn't want to oversimplify outcomes, and for provision that might offer support across several categories. There might be some services that offer more than one category, and we know even within those categories, the support, the shape and size of that provision can be very different. So we think we wanted to get front and center a bit more of a balance, a bit more nuance, and we're particularly mindful that this is unregulated provision at the moment. This is the first time we've regulated it, and we think it's too early to say, to give something. You'll notice here that there's not something that you might perceive as an equivalent of an outstanding judgment. We think we need to do at least one round of inspections before we can say something is outstanding. We think we need to set and understand a benchmark of exceptional practice, and we think the first year we can learn from that, first round of inspections rather, we can learn from that, and then with more confidence consider putting a judgment in that might be the equivalent of an outstanding or exceptional or excellent practice. Although I should say that if we do see something that we think is particularly good or outstanding, we'll report on it. We're not going to avoid it. We want to celebrate exceptional practice as much in these inspections as we do anywhere else, even if they have different headline judgments. So I think I've covered the first bullet point. The reason why we want to do that 3 outcomes model is that we think it's a more nuanced statement of quality across a diverse sector. We think that the 1 or 2 word judgment of good or requires improvement or outstanding, etc., might have a risk of providing false reassurance of quality, because it may be strong in some areas but less strong in other areas, and we really want to point commissioners towards the detail to make sure that the decisions they make for children is based on a broader understanding of the quality across what might be very varied and diverse provision. We still got the aspirational element of the 4-point scale. We've still got that consistently strong. So we think, we did think about having just either above or below the line. It's either serious or widespread or no serious or widespread concerns, and they meet the standards. But we thought that just lacked ambition and aspiration. So we did want to have something that incentivized people really to be ambitious for children. Hopefully this won't reduce their ambition to be as good as they possibly can be on behalf of children. So I'm sorry for rattling through this very quickly. There's 2 further areas of consultation that we want you to have a look at and consider what you think about them. We're proposing that we give 2 days notice of inspection. We think that's the minimum notice we need to give. We need to plan our activity. We want to make sure we make the best use of time that we have on site. I know that some young people, a lot of young people, when they talk to us about it, they'd rather we just turn up and see providers exactly as they are. I'm not sure they'll be happy if we just turn knocking on their door, saying, hello, we're from Ofsted and we'd like to visit you now. We think we need to give children opportunity to give informed consent about talking to us. We need to plan a reasonable timetable. We need to help you get the information ready for us to develop lines of inquiry and get, agree a good timetable. And that's similar to what we do in fostering agencies, which is another provider level inspection, and we think that works well. It might feel short, 2 days. I think if we gave you any longer, you might wish we hadn't, because the longer we give you, the more we know that you end up preparing for inspection, and I'm sure you'd just be rather getting on with the day job. So we'll try and make our expectations of you in terms of preparation as clear as possible in the guidance, so there's no surprises when we do ring you up and say we'd like to inspect you. But also we would like to make sure that anything that we do is reasonable and fits in with your usual activity as far as possible and doesn't disturb what you need to do on a day-to-day basis. We're also setting out some proposals for what we think inspectors should look at that will help us develop the criteria that we have for evaluation. And we hope that we've got them right. We've based it on what young people have told us. We've based it on the available research. So we think it's evidence-based, but we do want to check it out with stakeholders to make sure we're looking at the most important things for children. So please comment on what we have set out, but also tell us if you think there's anything we've missed. So you've got until the 8th of September There's an online survey. There's also a young person's version of the consultation that's online. So where you can, please share that with young people as well. We've got a QR code, which is really exciting for us as we enter the 21st century. So please take a picture of that if you like, and that'll take you straight to the consultation. And that's just basically a summary of what I've just said. But I'll share these slides anyway.